By the early 2010s, Kenya's national test scores placed the country at the top of regional rankings for literacy and numeracy in Eastern and Southern Africa. SOCMEC assessments captured a massive performance surge. Between 2007 and 2013, Kenya's reading rose 58 points and math jumped 94 points, securing top 3 regional rankings. But trailing only Mauritius provided a benchmark for what absolute regional dominance actually looked like. If you only look at these high-level national averages, the curriculum appears to be a resounding success story. The data suggests a system that is delivering on its promises. But these averages were masking a crisis. When independent household surveys from Uwezo and diagnostic data from NASMELA began looking at individual learners, they found a massive blind spot in the national data. The granular reports revealed that 3 out of 10 Class 3 learners were unable to complete basic Class 2 work. At the earliest levels, the numbers were even more stark. Over 50% of Class 1 learners were evaluated as zero readers in English, meaning they could not recognize or read a single word correctly. This paradox existed because the traditional 8-4-4 system prioritized high-stakes ranking and rote memorization. It moved students through the grades based on their ability to repeat facts rather than their mastery of foundational skills. In this environment, the curriculum functioned as a static document, one that rewarded a few top performers while failing to track whether the most vulnerable students were actually acquiring basic literacy. To address these gaps, national assessments had to move beyond simple pass-fail exams. Policymakers needed tools that could diagnose exactly where teaching and learning were breaking down. Assessments like the NASMELA began distinguishing between emergent reading, the basic ability to sound out letters, and reading for meaning, which measures whether a student can actually comprehend a sentence. The diagnostics uncovered a systemic flaw. Students were capable of memorizing facts to pass a test, but they lacked the competency to apply that knowledge to real-world tasks or solve unfamiliar problems. Testing a student's memory is ineffective if the system fails to measure their actual capability to function and solve problems in society. When researchers sliced this diagnostic data demographically, the national averages fractured, exposing deep inequalities that the top-line numbers had buried. The data showed a sharp geographic divide. While urban private schools performed well, learners in rural public schools and arid and semi-arid regions consistently recorded the lowest scores in both literacy and numeracy. The gaps extended to wealth and gender as well. Boys often outperformed girls in math, while a mother's education level was a primary predictor of success. Children of mothers with tertiary education were 80% more likely to meet reading expectations than those whose mothers only finished primary school. Longitudinal tracking proved that simply increasing resources through the Free Primary Education Initiative was insufficient. Without overhauling teaching methods to match the needs of different regions, raw inputs like textbooks and classrooms were not translating into learning. The evidence showed that the curriculum design was fundamentally inequitable. It assumed a level of resources that didn't exist in most rural contexts, demanding a total redesign to serve all Kenyan children. This mountain of evidence eventually forced policymakers to move away from the ranking-obsessed 8-4-4 system entirely. The competency-based curriculum, or CBC, was designed as the direct, data-driven solution to the literacy and rote memorization crisis identified in the reports. The CBC philosophy re-engineered the system to prioritize real-world skills over memorizing facts. It uses learner-centric teaching methods, where students master competencies through practical application rather than passive listening. This shifted the entire national education philosophy from measuring what a student knows to measuring what a student can actually do. Beyond the broad system change, the data allowed for targeted interventions like the TUSOMA Early Literacy Program, specifically designed to address the zero-reader crisis in lower primary grades. These interventions worked. By tracking fluency in real time, the TUSOMA program helped the percentage of fluent Class 2 English readers jump to 47% before the pandemic disruptions. While COVID-19 school closures reversed many of these gains, the existence of continuous tracking meant the government could immediately see the damage and begin adjusting the recovery strategy. Modern assessment data is no longer used to rank students or punish schools. It is used to grade the health of the government's policies and the effectiveness of the syllabus itself. Using assessments to track equity and learning gaps forces the curriculum to function as a continuous feedback loop. This data-driven approach allows the system to adapt its content and teaching methods until every child is actually learning.